In terms of saying no to unnecessary procedures, I think realistically the one that you're going to be most commonly faced with would be kind of inappropriate use of veneers or crowns. And certainly this has been something that I've published on, is that, you know, there has been a large amount of dentistry undertaken in the past when we kind of had this veneer craze from America. And it kind of merged with people were placing veneers and they were placing crowns that, you know, were really probably not appropriate in a lot of cases. So I think the first thing to say is don't be afraid to say no. Two reasons really. If you think that the sacrifice of tooth tissue that you're going to undertake is too severe for the benefit they're going to gain, or if the patient is not applicable in terms of the periodontal condition or the occlusion. Now, if it's the periodontal condition or the occlusion, just be happy to explain that the foundations aren't right or the occlusion isn't right, so the longevity is not going to be there. So just say, look, well, I'm not prepared to undertake it because at the end of the day, the foundations aren't right or it won't last. So I'm not going to undertake it because I'm not going to be acting in your best interest, and leave it at that. Yes, these patients may go elsewhere, and I have seen them go elsewhere to get this treatment done, but that is then the problem of the other dentist. And don't forget, you're then open to, if you do undertake the treatment, however good your consent is, you could be open to litigation or consequences from bodies such as the General Dental Council. There then is the other kind of side of it, is should you be doing veneers or crowns really when it's a cosmetic issue? And no, what we should be looking at is, first of all, what is the problem? So if it's colour, it should be whitening. If it is tooth position, it should be some type of orthodontics. And if it's things like tiltings or rotations, then essentially it should be really looking at, you know, not at using veneers, but looking at using ortho and looking at using whitening, but also looking at bonding. So really going in with the most minimal interventions first of all. And again, you know, get across that you're acting in their best interest. You're trying to do the most minimally invasive thing that you can for them, because nothing lasts forever. And once they're in that restorative cycle, it won't last forever. But certainly don't be afraid to just say, no, I'm not happy to undertake this procedure, and don't do it. Certainly there are times, say, when I'm doing replacement of crown and bridge, that there are one or two teeth that, you know, are sound, and you do need to bring these out into the line of the arch and harmonise it. So I would freely admit that there are sometimes times when I crown teeth, etc., where I'm not 100% happy with doing it, but it is part of a bigger restorative plan. So those patients need to be carefully consented, and really I'm consenting them for possible pulp death, which could be 1 in 10, 1 in 2 pulps going, and that removal of tooth tissue as well. So they're being very carefully consented for it. Then I'm handling it very carefully in terms of doing things like the Pashley technique and bonding immediately to preserve the vitality. But I'm doing it in very particular instances where, you know, there is other work being done. So I think that's the way to really approach that question, and the way to communicate that to patients. But yeah, don't ever do work that you're not happy doing. And there was this old adage, well, if I don't do it, well, they'll go down the road and have it done. That's fine, let them go down the road and have it done. That's what I would say.